Indiana Newsdesk is made possible in part by the following. Indiana University's Center for Applied Cybersecurity Research, presenting Security Matters with tips for improving online security in 3 minutes or less. Main Source Bank, headquartered in Greensburg, Indiana, offering products and services to fit every stage of life. More information at mainsourcebank.com. Main Source, life needs a great bank. Member FDIC and equal housing lender.
Smithville Communications, serving Southern Indiana with high-speed fiber gigabit internet. Smithville Fiber Gigabit Technology. Tap the power.
And by WTIU members. Thank you.
Coming up on Indiana News Desk, nearly 1 in 5 Indiana girls is raped before she graduates high school. But in most classrooms, you won't find the topic of sexuality mentioned.
Schools need to step up and recognize that it can happen in their schools. There can be offenders in their schools, or there can be children in their school who are experiencing child sexual abuse outside their school.
What responsibility do schools have when it comes to sexual assault prevention and education? The battle over who gets to sell cold beer in Indiana wages on.
It's not government's place to say, hey, this particular retailer has the liberty of cooling to what the consumer wants while the others don't, giving a monopoly to one side of the business.
And health providers are trying to prepare for an influx of mental health patients who now qualify for coverage under the Affordable Care Act. Why more funding doesn't necessarily mean it'll be easier for patients to get care. Those stories and a look at this week's top stories right now on Indiana News Desk. Hello, I'm Joe Wren, and welcome to Indiana News Desk. A couple big stories to get to right off the top this week. Education leaders made a significant first step addressing Indiana's rate of teen sexual assault. That story's next. Our other top story, attorneys representing Indiana's convenience stores say it makes no sense that only liquor stores are allowed to sell cold beer. The group this week announced it's filing a new lawsuit and appealing an existing one. The Indiana Convenience Store Association filed a lawsuit against the state last year in federal court, seeking to strike down a law limiting cold beer sales to liquor stores. But a judge ruled against the organization last month, saying the legislature has the right to regulate alcohol sales, noting a compelling interest in reducing minors' access to cold beer. The association is appealing that ruling with a federal appeals court. And the group's attorneys are also filing a new lawsuit, this time in a Marion County court, arguing the law violates the Indiana Constitution.
You can never predict with certainty how anything will play out in court, but in the Indiana case, for instance, that in February of this year, the Indiana Supreme Court ruled squarely that you can't pick winners or losers in business. That's not government's role. And when they compared the Riverboat Casino to restaurants and bars in Evansville, said there's no reason to have a different treatment on smoking. Likewise, there's no reason to have a difference in treatment on authorized, licensed, permitted sellers of beer, that only one category can cool their beer.
Patrick Tam is the CEO of the Indiana Association of Beverage Retailers, representing Hoosier liquor stores, and calls the store suing the state large corporate interest with deep pockets.
We believe alcohol is very much different than peanut butter. Our gas station friends would very much like to sell it like peanut butter, and we believe that alcohol is sold in a regulated environment because there are consequences when you misuse or inappropriately sell alcohol.
To comply with law.
Plaintiff's attorney John Maley says the cold beer market is quite lucrative. He estimates there's likely millions of dollars involved.
Are we Hoosiers going to have to pay a premium to go to a dark liquor store that doesn't have police traffic around it, or can we get it at a competitive price? So we would expect that a share of that cooled beer market would move into the grocery stores, convenience stores, and pharmacies.
Maley didn't say when he expected action in the new state court case. He says a federal court should decide on the appeal within a year. Indiana has the second highest rate of sexual assault among teenage girls in the country. Why it's such a major problem here is a complicated question, but the state's school leaders are beginning to ask what more they can do to prevent it. Sarah Whitmire reports on a new campaign the Department of Education is launching to help school districts develop policies and best practices to combat sexual abuse.
Schools aren't mandated in Indiana to teach sexuality, so the State Department of Education doesn't keep data on how much time, if any, teachers spend discussing it in their classrooms. Experts who contributed to WTIU's documentary last year on teen sexual assault stressed the need for educators to step up.
We're all kind of taught that these are things that shouldn't be talked about in school for the most part. I think the data make it pretty clear that that attitude carries a huge price for us. And it's that we can all pretty easily pretend this isn't going on, but it is. I think that is almost certainly the major, I don't want to call it provincialism, but just that provincial American attitude of, no, you're not going to talk to my kid about that stuff.
This week's conference marked the kickoff of the unified campaign to combat sex abuse. Its goal, to give education leaders the tools they need to begin combating the problem of child sexual abuse. It drew together activists, prosecutors, therapists, and communication experts to help schools develop policies aimed at protecting children.
Most offenders are someone within the child's family.
Child sexual abuse educator Karen Duncan says beginning in kindergarten, the classroom is the perfect place to begin teaching about sexuality.
We live in such a highly sexualized society, but we adults are so uncomfortable talking about sexuality and sexual development. Teaching children about their own sexual development, human sexual development, is not going to cause them a propensity towards other things that parents or other adults may be afraid of. It actually teaches them how to respect their bodies, honor their body, respect other people, and that's a part of the value building that comes from education and training with children.
Then the curriculum advances each year with the student. Jane Noggle teaches a 6-week program called Safe Dates to 7th graders during study hall at Scottsburg Middle School. She started doing it a few years ago after recognizing sexual abuse was a growing problem her students were facing.
We teach math all 12 years of school. We teach science all 12 years of school. I think we should have personal social curriculum for all 12 years of school as well.
The sex abuse campaign includes more conferences this fall focused on how to recognize and respond to the abuse of school-age children and reporting requirements. It also includes, as an agenda item, child sex abuse prevention curriculum.
And Sarah Whitmire joins us now for more. Sarah, since 1970, Indiana's rate of sexual assault, now this is among teenage girls, has been consistent. It's about 1 in 5. But now schools are finally starting to do something about this.
Right. In 2010, the state legislature did pass what was called Heather's Law, but it largely dealt with teen dating violence. But one thing included in that was that the Department of Education was required to set up a website that included some curricula that could get at the issue of sexual violence. And while everybody would say that's a good thing, critics did charge that it just didn't go nearly far enough. It didn't teach about prevention really at all. So this is the first time that we've really heard that mentioned, that schools would be taking a lead in sort of addressing violence before it occurred.
So this new campaign really aims to do that.
Yeah, I think everyone could agree this is a first step towards getting at that. But, you know, it's very early on. You know, this just happened this week. There is another meeting that happened today. But I think this is an acknowledgement that the community, the schools, everyone has to get involved. But I think an important part of this is that still nothing is required. You know, this whole campaign is completely voluntary. Educators can go if they want, and we're still a long way from saying any curriculum is going to be mandated in schools in Indiana.
Thank you, Sarah.
Thank you, Joe.
Now we go to Alex Dirkman for a look at this week's top stories.
Thank you, Joe. A Marion County Superior Court judge is ordering the Bureau of Motor Vehicles for the second time to issue personalized license plates. The BMV suspended its program after a lawsuit was filed arguing that its criteria for approving the plates was arbitrary. In May, a judge agreed with that argument, ordering the BMV to reinstate its program and create new criteria. The The BMV asked the judge to suspend his ruling during the appeal process. Now, the Marion County judge has denied that request. Democrats are accusing Governor Mike Pence of hoarding tax dollars at the expense of funding critical programs, just so he could pad the state's reserves. The state closed the books on its fiscal year this week with a surplus of more than $100 million and reserves topping $2 billion. Achieving that surplus level was accomplished by cutting the budgets of state agencies and universities. The director of the Office of Management and Budget says the $100 million surplus was built into the budget, and it was important for the state to hit that mark. U.S. Attorney Joe Hogsett is resigning, and speculation is swirling about what his next move will be. Hogsett has been considered a possible Democratic candidate for Indianapolis mayor, governor, or even a U.S. senator. Hogsett's resignation is official July 31st. Political analysts say the timing points to higher ambitions. Former Governor and U.S. Senator Evan Bayh says he'll sit down with his wife in the next month or so to discuss his political future. Bayh has been working as a policy analyst and a political commentator since he abruptly decided in 2010 not to seek a third Senate term. He's donated some of his remaining campaign funds, which total nearly $10 million, to various Hoosier Democrats. Many are wondering if Bayh will throw his hat into the ring for a gubernatorial run in 2016. Secular officials can now marry couples. An appeals court this week overturned Indiana's law that only allows clergy or government officials to solemnize marriages. The atheist group, the Center for Inquiry, brought the lawsuit claiming the state was making non-religious people unequal under the law. Student borrowing is down 11% across Indiana University's 7 campuses. As David Hamilton reports, that amounts to more than $30 million.
The rate at which IU's student loan debt decreased last year is more than 5 times the average drop for public universities nationally. The university began sending out letters to students in the 2012-2013 academic year, laying out each person's financial situation. The move came after faculty members expressed concerns that students were complaining to them about not knowing how much debt they were accumulating.
That was kind of a wake-up for us to say, we'd really like to have more kind of an annual letter and other things that we can talk to students about just so they're fully aware of their student loan debt at all times.
The university also points to a financial literacy initiative launched last year. But Professor Don Hostler says the drop in debt probably has more to do with the recession rather than the university programs.
Frankly, I think those initiatives are too new to have had that much impact yet on student debt.
Hostler thinks the initiatives are a positive step, but he says overall people are just more cost sensitive and aware of what they're spending.
A community of nuns in Terre Haute is searching for new ways to make up for the millions of dollars in healthcare costs they're expected to incur as the sisters age. The Sisters of Providence of St. Mary of the Woods had a deal with Country Mark to drill for oil on some of their property. But after scanning the ground, Country Mark said there was not enough oil to make drilling economically feasible. The head nun at the congregation says while they're disappointed, they're also relieved because many believe drilling for oil conflicted with their mission of eco-justice. The sisters are now hiring a consultant to look into alternative sources of revenue. And football players from high schools around the state are using a new concussion preventative device in tonight's All-Star game.
Well, this is one of our high school helmets, one of the helmets that the guys will be using in the game, and this is a Brain Sentry, which is basically a helmet sensor that senses a certain amount of force that a kid would take during a hit in football.
If the hit is minor, the device does nothing. But if it's strong enough to cause a concussion, a red light flashes, alerting coaches that the player should be pulled off the field and checked for concussive symptoms.
If a player doesn't want to come out, or if a player thinks, oh, I'm fine, but it was a big hit and the coach didn't see it happen, this is another set of eyes just so that coaches can do everything in their power to keep players safe.
Joe, there's nearly 100 football players on this North and South All-Star team, and they've been practicing with the sensors all week, so we'll have to see how that goes in tonight's game.
Football in July.
Yeah.
What time's kickoff?
It is at 7 p.m., so not too far away.
Okay, thanks, Alex.
Yes.
Coming up next on Indiana Newsdesk. Some Hoosiers who signed up for health care under the Affordable Care Act say they're no better off now than they were before they had insurance. Ahead, why it's so difficult for patients who suffer from mental illnesses to get help. And it was a sweep at the Indiana State Fair's Brewers competition. We'll take you to the Indiana brewery that took home all this year's top honors. These stories right here on Indiana Newsdesk.
He can swim with whales without missing his bus. She can step on stage with Shakespeare while sitting at her desk.
The great globe itself.
They can travel through time and get back before lunch. Today, learning has no limits. See how millions of students and teachers nationwide are using PBS Learning Media to ignite learning. Visit pbslearningmedia.org.
Turn to PBS for stories that define the American experience.
All of this stuff was just erupting.
Revealing our strengths.
You create a new future.
Our struggles.
It's very American to say, this is not right.
These are our stories.
We were so innocent, and oddly enough, we were so American.
Our American experience.
Tuesday evening at 9.
Welcome back to Indiana Newsdesk. I'm Joe Wren. Hospitals are seeing more patients for mental health issues now that the Affordable Care Act is in place. Researchers say that could be a good thing because more people are getting care. On the other hand, it could also be because they aren't getting the preventative care they need and are instead ending up in emergency rooms. Gretchen Frazee reports on the changes to mental health care in Indiana and what patients and healthcare professionals say needs to be done to better meet changing demands.
This is selenium, which I also take.
Teresa Colby takes a lot of medications. Most are for her diabetes. Some, like sertraline, the generic version of Zoloft, are for the depression that she says goes hand in hand with her Asperger's.
I have difficulty with social relationships and as part of my disability, and I just didn't have the network to help me with anything, and it was a really difficult time. It really was.
Several years ago, Colby's depression got so bad she knew she had to do something fast. With no insurance and no access to mental health services, she sought help at IU Health Bloomington Hospital.
I walked in one day and I said, I'm like afraid I'm going to hurt myself, and had what was essentially a nervous breakdown.
Colby says the care she got, while it kept her from committing suicide, did not help her deal with her depression long term.
They do sort of like emergency stopgap care, but they don't really do anything to address the long-term situation, and then there's no follow-up care. So basically it scared me into thinking, well, I can't be mentally ill, because if I do, I'll get locked up.
A joint study from Indiana University and Purdue University found hospitals nationwide are seeing a 9% increase in patients ages 19 to 25 who are being admitted because of situations like Colby's. They're at risk of attempting suicide, or they need intensive psychiatric care. Researchers don't know exactly why those patients are going to hospitals instead of independent counselors, but many, they say, are likely in the same position as Colby. They don't have access to mental health services. Jean Scallon is the CEO at Meadows Hospital in Bloomington, and she says many of her patients commute 2 or more hours to be seen.
How do we make sure that they have access to care in the communities that they're at so they don't end up right back in inpatient again? Because that's, we wouldn't want that. That's like having multiple heart attacks.
It's a complicated problem. There aren't enough clinics, in part because there aren't enough doctors who study mental health. And there aren't enough doctors going into the field because
if there hasn't been in the past good funding for services that affect people who have these conditions, then the supply doesn't necessarily grow. So it's hard for people in medical school to decide to go into areas that are underserved if it appears really hard to break even because there's no source of funding.
With the newest part of the Affordable Care Act going into effect this year, providers expect to receive additional funding from insurance companies that are now required to cover mental health services at approximately the same rate as other medical care. Teresa Colby signed up for insurance through the federal marketplace.
I was really excited. Yay, I'm going to have insurance. I can, even get a full-time job and work more and do more and get my income up there and be productive.
But she says it falls short of expectations, and she doesn't believe it will be the magic bullet that improves access to mental health services for everyone. For example, her insurance plan only covers 12 counseling sessions per year.
The way I look at it, it's sort of like, okay, say you're starving and you have no food, and they say, we're going to give you 12 meals, okay? And then after 12 meals, that's all you get. And you're going, but what do I do after that?
Under the law, therapists can request the insurance company pay for additional sessions, but it must be deemed medically necessary. Colby also has to pay a $40 copay for each counseling session, and she says she simply can't afford that, so she hasn't been to any counseling since she got insurance. Her primary care physician still provides her with medication for her depression, though, and she's found support through the College Internship Program, an organization that helps students with learning disabilities succeed in college.
Try. Go ahead and try. You're doing good. You're doing a good job.
A job agency helped her find employment here, and she says working with people who don't judge her and being able to help students who have the same kinds of struggles helps her cope with her own insecurities.
To really heal from mental health issues, it needs to be a comprehensive approach that involves your family, your community, a certain acceptance, and it's not take this pill and in 5 days you're well. It is a lifelong struggle for a lot of people.
Even with the Affordable Care Act, about 300,000 people in Indiana still fall into what's being called the coverage gap. They don't qualify for federal subsidies on the exchange, but they don't qualify for Medicaid either. But the state recently submitted a proposal to the federal government asking whether it could expand Medicaid using the Healthy Indiana plan under a new version it's calling HIP 2.0. To talk more about how that plan plays into mental health care coverage in Indiana, we're joined by Bob Sigmund. He's the Senior Vice President for Healthcare Integration and Collaboration at Centerstone. It's an organization that provides mental health services here in the state. Bob, thanks for being here. Let's start with your experience. Are you seeing more people or more mental health patients due to the Affordable Care Act?
We are seeing a few more because of the marketplace that opened on January 1st of last year. But we anticipate that the real change is going to come from a Medicaid expansion, which is the governor is calling HIP 2.0.
And the HIP 2.0 that we talked about in the story, the health care coverage, does that affect a lot in Indiana?
Oh, certainly. There are 300,000 or 400,000 Hoosiers who are below 100% of poverty. They are not eligible to apply for a product on the marketplace. And at the same time, they cannot afford any coverage. They're not eligible for Medicaid either unless we have an expansion.
Now, do people who qualify for this, do they know that they're covered?
Well, that's going to be our job when the expansion actually passes. And the governor has sent a waiver to Washington, and that still has to come through. But when the expansion actually passes and we have HIP 2.0, then it's going to be our job to get the word out to folks that they are eligible for.
How do you do that? How do you get that word out?
Well, I think there are a variety of ways. There'll be advertising that's done. There's been advertising done in the 4 states that surround us on Medicaid expansion in those states. And we'll also have folks who are trained as navigators to help people. If people have this benefit, then it's going to be important to let them know that they're now eligible for Medicaid.
Then the question is the coverage enough? We just heard from Teresa. She made that analogy with food, about having 12 meals and then you're done. Is this coverage going to be enough?
Well, it should be. It should be. The companies that are going to be offering the insurance product here are supposed to follow federal parity laws. And that means that the mental health or addictions benefit should be equal to what a medical or surgery benefit would be.
Will HIP 2.0 provide you with the additional funding that you would need to expand these services?
Yes, most definitely. There will be additional funding, and we're real pleased to have that. Something that's important to realize that folks with severe mental health problems, can already qualify for Medicaid. People with severe addiction problems below 100% of Medicaid of poverty cannot. So this is going to be an opportunity for a lot of people with addictions to get treatment that hasn't been available before.
And lastly, do you expect that this balance will eventually work out?
Yes, indeed. This is a chicken and egg question. What comes first, the funding or the services? If we don't have the funding, we're not going to have the services. And with the funding, we can gradually build up the service availability.
All right. Well, thank you very much for your perspective.
Okay.
Very interesting.
Great. Thank you, Joe.
And something worthy of a toast, Upland Brewing Company walked away with all the top honors in this year's Indiana State Fair Brewers Cup competition. The Bloomington-based company was named Indiana Brewery of the Year and Grand Champion Brewery of the Year. Upland also collected the Best of Show award for its Vino Synth Red, a blend of Sour Reserve and Malfactor Flanders style red ale aged on Catawba grapes. Upland received medals for 5 of its other beers, including Champagne Velvet and Malfactor, which is aged in bourbon barrels. Upland's vice president told us what the brewery does well is be different. They try things others don't. That's the end of this program, but our work continues online as we continue to cover the news in Southern Indiana throughout the week at WTIUnews.org. Have a great weekend.
Indiana Newsdesk is made possible in part by the following: Indiana University's Center for Applied Cybersecurity Research, presenting Security Matters with tips for improving online security in 3 minutes or less. Main Source Bank, headquartered in Greensburg, Indiana, offering products and services to fit every stage of life. More information at mainsourcebank.com. Main Source, life needs a great bank. Member FDIC and equal housing lender.
Smithville Communications, serving Southern Indiana with high-speed fiber gigabit internet. Smithville Fiber Gigabit Technology. Tap the power.
And by WTIU members. Thank you.